Now we'll talk about two abnormalities in your chin. Okay, your chin. Okay, so your chin could be too small, where they say it was retro. It's going to the back. Retrognathism. Your jaw could be too protruded, and they say it was prognathism. Mandibular. Okay, yeah. Okay, maxilla is up, mandibular is down. Okay, sometimes there's way this anatomy to skip or anatomy to go. Okay, so you're talking about your jaw. Okay, that's your mandible. Okay, so let's quickly have some insight. So it's literal and simple. It's a simple concept. So you should know that mandibular prognathism and mandibular retrognathism are conditions, and is just anything that is what deviating from the normal jaw. Your normal jaw should be relatively fine. There's a way you can't really describe it, but it should be fine. So when it's inside or too outside, you have an issue. Okay, those are the issues we are discussing. So I think this is what we have, and when they occur, most of the issues there is your ability to chew food and also your facial profile. You don't like the way your face looks like, you know, your face doesn't look good. Okay, to you, all right. If you can be able to chew food, you can say fine, love yourself. But the issues that are concerning to a doctor is when a patient is not able to feed well, you know. So mandibular prognathism, that's the first one when the jaw is moving to sorry, the jaw is moving what? Twofold. Okay. So definition is the mandible projects forward beyond the maxilla. Your up, see, your up of your mouth is what? Maxilla. If the down is going too forward, you know. So you have a prominent chin and you have an underbite. If you want to chew something, you can't be able to, when your mouth is positioned that your teeth are jamming each other so that you can chew very well. Do you understand? Causes could be genetic, where somebody is just born with teeth, or in a family, they just happen to be like that. Okay? Or sometimes it's excessive mandibular growth, deficient maxillary growth, different symptoms like syndromes like acromegaly, where somebody's growing too much. There's too much secretion of growth hormone, and also the Crouzon syndrome. So effect is you have difficulties in chewing and biting. That's the first issue there. Speech issues, aesthetic concerns, you don't like the way your body looks like, you don't look cute, so you don't like it. So treatment is what? Orthodontics and also what? Orthognathic surgeries. Alright. Then we have the mandibular retro. When it says this retro, it's retrogressing. It's to the back. So your jaw is what's behind. Your maxilla is in front, while your mandible is lagging behind. So most of the times, let me draw this. You have the teeth. Why this one, the teeth is beginning here. Okay, this is your mouth, then your face start like this. Okay, so it's the same thing. One of the issues was difficulties in chewing. Okay, so the mandible is positioned posterior relative to the maxilla. Appearance, you have a receding chin. I have an overbite. Do you understand? The first one, your mandible was what? Going to the front. So the bite was more on the underside, so underbite. This one, your maxilla is going to the front. The bite is more on the up, so they call it overbite. So causes is genetic predisposition, deficient mandibular growth, and also traumas. So effect is what? Dental malocclusion. You can't close your mouth all. So most people, this one is protruded, and their mouth is kind of like almost permanently open. Yeah. Breathing issues, facial imbalance, you don't like the way you look. Treatment is still orthodontics and also what? Orthognathic uh, surgeries. Okay. So I think basically that's what we got. Okay. Okay. So that's it.